Alcohol before sleep, benefit or harm? Is it a soothing or a soporific that improves sleep? Or on the contrary, is it a stimulant as alcohol sleep is said to be short and restless? To this day, a lot of ink is being spilled on this topic even in the professional community. Some say that just like a drop of nicotine can kill a horse, so can a drop of alcohol eventually kill a person. Other doctors, particularly cardiologists, say that a small dose of alcohol has a preventive effect on patients with cardiovascular pathology. Let's figure all this out. And if you watch the video to the end, you will find out what dose of alcohol is relatively safe if it is taken by a healthy adult and can actually have a calming and even to a certain extent a sedative effect. I'm Roman Buzunov, a sleep doctor, professor, and doctor of medical sciences. For over 3 decades, I've specialized in diagnosing and treating sleep disorders. So, of course, in large doses, it's obvious that alcohol is poison. And to consume alcohol is completely unreasonable and even dangerous. But at the same time, often to my videos, when I talk about this or that methods of prevention or treatment of insomnia, some cognitive behavioral approaches, anti-stress techniques, physical exertion, or even there in the drugs, comments are like this. Doctor, what are you talking about? 100 grams, 200, 300 before bed results in remarkable sleep. No need to tell fairy tales, that's all so to speak. We absolutely don't need it. Alcohol helps wonderfully. Although there is another situation when literally not long ago, for example, a relatively young girl came to me, a little over 30, and she told with disgust that she drinks a bottle of wine before sleep because she can't fall asleep without it. She realizes that not drinking leads to insomnia, causing a dilemma. She's grappling with insomnia and needs a solution, while also recognizing that her drinking could soon lead to alcoholism. Generally, she was essentially correct. So, if we're talking about directly using alcohol to treat sleep disorders, that's definitely not it. But if we're talking about a certain calming dose, a relaxing dose, just a dose that allows to reduce stress and to some extent allows better sleep, then such doses exist. I'll talk about them a bit later. But now I want to discuss such a thing, especially when opponents of alcohol say that any drop of alcohol is extraordinarily harmful. Listen, is it okay to consume kvass? So kvass contains from 0 to a whole 5% of alcohol. That is, if a person drinks a liter of kvass, then he actually consumes 15 milliliters of pure alcohol, and kvass is even allowed for children. But if a person drinks a liter of such kvass and then gets behind the wheel, and a policeman stops him somewhere and makes him blow into a tube, it will turn red because the alcohol in the blood will already be determined. And this is the basis for taking away the rights of such a person. Moreover, I would say that there is alcohol in the intestine producing bacteria. Our microbiome not only produces serotonin and melatonin, but also alcohol in part. Moreover, it is present in tiny doses in almost every person. But there is such a thing as endogenous alcoholization, if I may say so, when pathogenic bacteria, particularly Klebsiella, begin to actively produce alcohol in the intestine, especially if a person consumes a lot of carbohydrate-rich food. That is, fermentation begins, and just as this fermentation occurs in bottles where wine is brewed, so too does fermentation occur in the intestine. And even I have such a job here. Xin Yuan from the Beijing Institute became interested in a patient who did not consume alcohol but consumed a lot of carbohydrates. His blood ethanol concentration was roughly 400 milligrams per liter, equivalent to 0.4 promille. In fact, this is a stage of intoxication, already quite significant. But it turned out that it was the yeast in his body that produced this alcohol, and he didn't consume anything like it himself. Moreover, what about kefir? Up to a whole 5% alcohol concentration in regular kefir. That is to say, if a person drinks a liter of kefir, it's like 5 milliliters of pure alcohol, And kefir, is even shown to infants, yes. So to say that just any drop kills accordingly a person, so to speak, is not possible. But it's clear that any medicine can be turned into poison with unmeasured dosing. Moreover, if a person's body itself produces alcohol and the person additionally consumes it, then one can overdose, so to speak, both internal and external alcohol and get practically drunk even from small doses of alcohol. But this already depends on each individual person. What else, of course, needs to be said? Why did I talk about safe doses in healthy people? For example, a patient with sleep apnea, and I consult such patients quite often because one of my main directions is the diagnosis and treatment of snoring and apnea. So in overweight people suffering from apnea and abusing alcohol, the risk of complications is very high. Well, I'll explain the mechanism. Ethanol, first of all, stimulates brain activity and reduces muscle tone, and the respiratory paths collapse faster and the stops last longer because the brain doesn't care whether a person breathes or doesn't breathe. And there are studies that show that 200 milliliters of vodka taken by a man before sleep weighing 70 kilos intensifies sleep apnea by 2 times. And the next problem that can arise is a hangover. When asleep, the brain inadequately controls our body. Moreover, if during sleep we experience increased respiratory efforts, that is, we try to breathe, the stomach contracts, and there is a reflux of stomach contents. Generally, during a hiccup, which is common in children and adults, children often jump, the respiratory center is stimulated. But if the brain is under the influence of alcohol, there is also a cessation of breathing, there is also a lack of oxygen, and the brain wakes up, does not quite understand what is happening. It sends a command to inhale at the moment of hiccup. It takes just 0.4 milliliters of stomach contents to get into the trachea bronchi. A pronounced laryngospasm occurs. Then the person wakes up but cannot breathe. And this can sometimes last a few seconds, sometimes tens of seconds. The individual, generally believing he's dying, may turn blue. By the way, after this, people often start going to doctors, and by the way, they even quit drinking alcohol in significant amounts because the person really thinks that he could die. But that's actually the case. Because if 20 milliliters of stomach contents get into the trachea, the bronchi close up, and that's it, practically instantaneous sudden death. Death is essentially from choking on your own fat masses. And it's a known situation that alcoholics, yes, even in their sleep, they have such reflexes, and there can also be sudden death in sleep. Hence, patients suffering from snoring or severe apnea are strictly prohibited from consuming alcohol. But this also applies to patients, for example, with the same serious liver diseases, even if it is associated, for example, not with alcohol, but with hepatitis. If a person consumes some dose of alcohol and the liver processes alcohol, then accordingly, the likelihood of developing cirrhosis is significantly higher. Well, I won't hear not the topic, let's say, of our conversation about some diseases. In general, once again, if we are not taking diseases now, we are talking about a relatively healthy person. I told you that at the end I will tell you what dose of alcohol can be. But I might say it before that. Remember, I said that patients react so actively that they want to consume alcohol. And yet my task is not to explain to people that this is harmful enough. In addition to this, I implement cognitive behavioral therapy programs for insomnia, which without any alcohol, a person simply engages in certain techniques to increase stress resistance, life patterns, changes, and so on, copes with sleep disorders without taking any chemical, let's say, equivalents which calm the brain. But let's approach the dose. So if a person is healthy enough, then from 10 to 20 milliliters of pure alcohol, in fact, it turns out to be somewhere around 150 grams of dry wine. This is half a bottle of beer, or it's approximately 40 milliliters of strong alcohol. This is the dose that, for a healthy, let me emphasize, adult person, is unlikely to cause any serious side effects, but at the same time will provide a calming, relaxing result. But it's the same as with medications, with sleeping pills. If situational use, for example, is considered 6 to 8 times a month, it minimizes the risk of developing psychological and physical dependence on sleeping pills. And if a person starts to use them regularly, in the end, it turns into constant use. psychological, then physical dependence develops and the need to increase doses. And we explain to patients that 6 to 8 intakes, a maximum of 10 intakes per month, is the threshold that should not be crossed, because from there you can quickly fall into dependence on sleeping pills. And if we say that one way or another a person uses alcohol as a sedative, relaxing, or even a sleeping aid, well, it's almost the same principle. Firstly, these are small doses, minimally effective, and as with drugs. Secondly, the same, let's say, 8 intakes per month. This is a situation that is unlikely to cause any serious illnesses and is unlikely to cause a person to develop psychological and further physical dependence, the development of alcoholism. But once again, I underline that probably just observing some basic hygiene rules, sleep lifestyle is better than, let's say, consuming alcohol to fall asleep faster. I wish you all a good sleep and, if possible, without alcohol.